My name is Amy Larsen. I'm a Neurology Physician Assistant specializing in headache medicine. I have worked in a number of different settings for neurology for this specialty. I've been on the outpatient general neuro side, and then I've worked inpatient in neurosurgery in the OR and in the ICU. I was drawn to medicine for a lot of different reasons. I've always loved science, and I really love the tangible ways that medicine allows me to help people improve their lives. It is challenging, it's never boring, and it's always changing, so there's always more to learn. And as far as why neurology and not other specialties, who doesn't love the brain? Neurology is so fascinating, and it's a field that's constantly evolving. I have a special interest in post-traumatic headache, having worked in neurosurgery and seen a lot of TBI. I also really enjoy treating trigeminal neuralgia, which can be extremely debilitating for patients. So it's rewarding to be able to help people find relief. I love to explain anatomy and pathophysiology with my patients, and as well as we currently have an understanding in science. I also like to go through what we call a differential diagnosis, which is a list of things that could be causing symptoms from a primary disorder to a secondary one. And I go through the reasoning of making a diagnosis. And then with medications, there's really only one option to choose from. So I like to present patients with the pros and cons of a couple of different options that have good evidence, and then involve them in the decision-making process. I personally experienced migraine and primary stabbing headache, which is also called ice pick headache. I also had a close family member battle glioblastoma, which is a type of primary brain cancer. My family member unfortunately passed away a few years ago from her brain cancer. But through her diagnosis, what she appreciated the most was just continuing to be with her family and loved ones, participating where she could. I think the most important thing for anyone going through that kind of thing is to not feel isolated or alone. In response to managing my own headache symptoms, as most patients have experienced, it's a trial and error process to find what works best. And I have over the years been able to explore which lifestyle triggers to avoid and manage, and when needed, which medications to take. But I also think it's important to have a healthy mindset. Good health is never a guarantee. And even when you do everything right, that doesn't mean you stop trying, but we have to remember that we can and should use both healthy lifestyle habits and modern medicine to reduce our risk. I am an advocate for self-advocacy. I encourage all my patients to be self-advocates in their health journey. Unfortunately, there's a lot of challenges in our healthcare system, and so it can take you advocating for yourself and standing up for yourself to get treatment, to get testing, and I encourage all my patients to do that. Hopefully, I convey, just as a member of their healthcare team, that I'm also in their corner and motivated to help them improve their lives.